So in this next video clip, we're going to look at some of the examination basics for lower cervical side bending. So let's get in a position where our eyes are approximately at the same level as the region of the spine that we're examining. And we'll start first with right lower cervical side bending. As your patient does this, ask impairment-related questions. Is there any compression-related discomfort on the right side, or perhaps any pulling or tugging sensation on the left, potentially indicating shortening of some of the axioscapular muscles? Okay. Bring the head back to neutral. And now let's look at left lower cervical side bending. So now we have a patient who doesn't want a left side bend. Ask the same questions. Is there compression-related discomfort on the left? Is there tugging and pulling on the right? Is our patient stopping left side bending short because they're in discomfort? One way to determine that is with a gently applied cervical overpressure test. So a little counter pressure here on the shoulder, a very light, gentle pressure. We press the patient into additional side bending. If this causes discomfort, clarify where that discomfort is. Clarify what the intensity of the discomfort is, and clarify what the character of the discomfort is. Was it dull and achy, or was that a sharp stabbing type of pain, potentially indicative of an instability or perhaps even a nerve root irritation? Now, left side bending was restricted in this case. Let's determine what level, C2 through C7, again our lower cervical segments, let's determine what level is most restricted. So we'll have our patient transition into a supine position, and we'll perform left passive segmental lower cervical side bending. There's more than one way to perform this test, but I like to hold the patient's back of their head in my right hand. We'll supinate and use the palmar and radial aspect of our second MCP, and we'll press on the lamina and inferior facet of C2 and side bend C2 down on C3. At that point, we move approximately a finger width down and side bend C3 down on C4, C4 down on C5, C5 down on C6. When you get to C6 on C7, the radial aspect of your second finger should be right at the nape of the neck, right where the neck's fitting into the shoulder. We side bend 6, down on 7, and then lastly we need to left side bend the cervical thoracic junction, so C7 on T1. Our direction has to change just a little bit. We press just a little bit more caudally as we side bend that 7th vertebrae down onto the first thoracic vertebrae. What we're looking for here are early stops. It's fairly common that when a cervical disc loses height, it drops down onto the von Luschka process on the level below. So disc space narrowing is one of your principal reasons for, and I should say later grade disc space narrowing is one of your principal reasons for restriction in segmental side bending.